Sloan, up here. Let's show her what we did on our knees. Sloan, I know that you want to jump, but we're going to do this first so we can show Grandma, okay? Come on. Come on, Sloan. Hey, you. Well, we don't want to take a nap on the trampoline. We're going to walk over here and get on this, okay? Here we go. We're going to do on your feet first? Okay. Let's show everyone what we were working on today. Can we show our one-legged work? Woo!
Wow.
So we're working on one-legged activities.
Look at that.
So that we have to try and get a lot of hip strength. Get up tall, 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 tall. There we go. And we worked with snakes and bugs today, right, Sloan?
I want to be a baby.
No, we're not going to play baby right now. We'll do that at the very end, okay? Okay, can you put this leg up for me?
After.
Thank you. We saw a baby today, though, didn't we? Was it a cute baby? A real baby?
That's the door for Mama and Dada.
The baby is now with his mom and dad.
Mm-hmm.
Yes, that's right. All right, so we did a lot of that work today. Let's show them your knees. That one's a little harder for you, isn't it? Down you go. Remember? Yeah, down on your knees, remember? There we go. But I want you to show you. We're going to go sideways so they can see. Here we go. I want you to be up, 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 up tall. Can you do that for me? Squeeze your booty and go up tall. Oh, hey! What happened? What happened? Did you get right back up? I want you to go down on your knees so we can work your hips because that's a hard position for you, isn't it? You just kind of want to sit down between your legs like that, and that's what we don't want to do. I want you to go up, up, up on your tall knees so your hips get strong. All right, Sloan, ready? Up. Can you do that for me? Nope. On your knees, sweetie, not on your foot. There we go, like that.
Mm-hmm.
There we go. That's hard work. But you can do it, huh? Can you let go and try it? Let's see if you can let go. Ready, set. Oh, that's hard. Especially on a swing. Let go.
Look at the balance.
Whoa,
Wow.
good working. We did a lot of work to do that today, didn't we? Whoa. Let's show them the other position we played in today. We were listening to music and playing with songs. And we did a butterfly position, just like this. Oh, don't lean on me. She was facing the other way, so she couldn't lean on me. But right here, and we had our hands here, and this is a fabulous position to stretch the inside muscles of our legs called the adductors. And it's super important because Sloan is going to want to overuse those muscles for a long time, especially when her legs get longer and her muscles don't get as long as quickly. Those muscles are going to get very, very tight very quickly. So this is the position we want to know well, is getting in this little butterfly position. And then also playing in the crisscross applesauce also helps as well. But sometimes going into this full position and getting a nice little stretch, and you can tell by her face, she can feel this. This is a nice stretch right here. Can you feel the stretch? Yeah. You feel a stretch? All right, I know we already did all of these things. We were just showing Grandma JoJo and Mom and Dad what we did, okay?
Wow. You're doing really great. That's awesome.
Yeah. And let's talk about your braces, okay? So I'm not sure when she received these, and these are perfectly great. I talked to Dr. Ong, and I discussed having the solid AFO as something that I thought was still really, really applicable for her.
Rather than the hinge.
Rather than the hinged, exactly. Okay. However, I think that we kind of also thought that a little bit more of a flexible solid is something that would be appropriate as well. Okay. So the next time we get new AFOs, I think that's an option we can look into, and just will kind of walk us through that. And so it's kind of a middle ground between a solid and a full hinged. Okay. And I think that would be a really good position for her to be in. And so she's right at the edge of these. Where'd the other one go? So she's getting to the point where we can start looking into getting new ones. Unless it's been less than 6 months, then we'll just wait. But, so you can see the little toes are just about to stick over the edge there. Which is fine. She's still perfectly safe for nowing these. However, when I took her out, she did have some redness in the heel. And she said that her foot hurt, kind of right there. That's where she pointed to. So it might be time to start looking into getting fitted.
Okay.
I actually have an orthotist that comes to this clinic and talks with me, which is so nice that we have that ability to kind of co-discuss what we think is most appropriate and what is the best fit. And then he can, oh, thank you. And then he can, there's the... then he can make adjustments mobily within his van here, which is so convenient. Because then you don't have to make extra appointments and take off work to go down to one of the other orthotist places. And I think he's a really good guy. He's done some excellent orthotics for me, so I highly recommend. His name is Dave Patterson with Hope Orthotics. Okay. So if you guys want to make an appointment, just let me know, and we can get that started.
Okay, great.
And again, depending on when she had her last ones. I was telling Allie these still fit, but we're getting to the point where they won't be soon. So if we don't do it now, that's fine, but in the near future, we'll probably make an appointment to get some new ones.
Was there anything else you wanted to, that you talked with Dr. Ong about that maybe was...
So we talked about the SDR again, and he's still highly thinking that that's the route that he's gonna refer you guys to talk with Gillette. We both discussed Gillette versus the other options, and that being the absolute best option. It's a little bit harder, obviously, for very obvious reasons, but the results that have come out of Gillette are just fantastic. The experiences that patients that I've had, Dr. Ong has had, have been excellent. And so they also have really good orthopedics there as well, which is super important because you kind of want to get a baseline of where her hips and her spine and her knees and her ankles kind of are now. So then post SDR, you have an idea of where you're headed. Obviously, the SDR is done so that you have less orthopedic surgeries in the future. But it's still really nice to have orthopedic opinions that are from top-notch orthopedic doctors. So not only do you have top neuro doctors there, neurosurgeons, you also have top orthopedics. So again, it's another reason to be in that network.
When is this projected? Like, did you talk at all?
I didn't talk to him about when he's going to be referring, but honestly, it's going to be sooner than later. And that's going to be up to parents of when that's going to work for family and whatnot. But at her age, usually that 2.5 to 3.5 age range is a really appropriate time to do to do an SDR because you're going to kind of get right in the middle of when she's learning a really good gait pattern. And right now, the reason I want her to stay in more of a solid AFO is because her gait pattern looks really pretty good. What happens is once they hit that growth spurt of preschool growth spurt, then their bones grow, their muscles don't grow as fast, and she'll get into more of a crouched gait as a result of that. And it becomes a lot more difficult to change a gait pattern after that. And so that's why it's really important to get to where you can decrease the spasticity as soon as possible using an SDR, strengthen the muscles around the joints, and prevent an improper gait pattern that's going to continually progress towards more poor orthopedic issues. Does that make sense? So that's why it's really important to get it done early. I've had patients go in and have procedures done at later ages. They've done really well, but it's also really important. It's harder. It's a harder recovery because they're so used to doing things a certain way. So if we can get her to start walking off of her toes, getting a nice heel-to-toe gait pattern, getting some nice full knee extension on both legs, not just one. She's got it really good on one, but not both. Then that's going to really prevent a lot of things in the future and give her the best possible outcome of proper gait in the future.
Surgery done on both at the same time? Is that what usual?
So the SDR is a spinal surgery. So
Oh, the spinal surgery. Okay. Why was I thinking like the lengthening?
Orthopedic is
Yeah.
the
Okay.
legs.
Okay.
So you're going to get an idea of what
I see.
what would,
Okay.
might be needed on
Right.
legs, if there's anything needed.
Uh-huh.
But really, you're going for specifically for the SDR. And,
Okay,
and
okay.
they're gonna determine if the specificity is enough
I see.
to where that would be an appropriate procedure for her. Dr. Ong seems to think that they
Okay.
will probably recommend it.
Okay.
That's what he thinks.
Good.
So.
This is perfect to be able to record everything because there's no way.
Oh, also, Monday is Columbus Day. I don't know if they have school off or not.
I don't know.
Okay.
I think they do, but I'm not going to say
If they're
absolutely.
out of work and they're wanting to come in, I can certainly try and schedule Sloan for an appointment on Monday.
Okay.
So we can have a face-to-face.
Okay.
I'd love to meet them.
Wow, that'd be great.
So
Okay.
just let me know.
Okay. Okay. Thanks a lot.
All right.
Same time. What
I
time
don't
wise?
know yet.
Oh, okay.
It'll
Okay.
vary.
Okay.
Yeah, it'll just depend
Okay.
on what, but we'll check with the front desk.
Okay. Great. Thanks.
All right.